Alaikum, Bismillahirrahmanirrahim. We should start this. The objective, as everybody can hear me. So, objective of this meeting is basically to let our special advisor to Prime Minister Dr. Faisal Sultan and also other, but I think most of us are familiar with international coalition as well as the merit programs. But it's good to reiterate and summarize it so that the federal government in Pakistan in health knows about it, and we discuss how we can better collaborate. So that's the basic objective. So in the first segment, we will, let you know about these, especially the ER. We are taking this opportunity to launch the ER program, the emergency medicine program. And of course, we will let you know about the APPNA Academy, the new initiative. And then I think then we would like to request Dr. Faisal Sultan to give his vision or his government's vision, and as particularly it relates to the international medical diaspora, how that fits into that vision, and whether there are any concrete steps that government has taken or is planning to take to facilitate that. And of course, after that, then we'll invite the leadership of Pakistan medical education and healthcare, eminent vice chancellors and other leaders to again very focus on how the international medical diaspora can work with their institution, and do they have a methodology and concrete steps to facilitate that? So it's the same question with the other leadership in Pakistan. And lastly, finally, we will introduce the emergency medicine international collaboration and take their opinion, what they want to do. And hopefully, if we stay on time, we'll have probably 5 to 10 minutes if there are any questions, and you can put those questions in chat also so that we can combine them instead of a person asking them on their own. So let's begin. I would invite our president, APPNA, Naheed Usmani, who is incidentally the founder of this committee way back in 2007. And she chaired this committee for 4 years in its evolution and founding years. So Dr. Usmani, please welcome the guests.
Ji, Assalamu alaikum everyone. Assalamu alaikum. Faisal. Dr. Faisal Sultan, as Shahid mentioned, is very special to me. We worked together for 5 years at Shaukat Khanum Cancer Hospital. So we are very grateful that you are here. I would like to welcome other worthy academicians, Professor Khalid Gondal, Vice Chancellor King Edward, Professor Imran Fazal, DG Medicine, and Dean Faculty of Medicine at NUMS, Professor Muhammad Umar, VC RMU, Professor Tanveer Khalik, VC Shahid Latif, Bhutto University, and Dr. Adil Haider, Dean AKU, and all the others, panelists from Australia, from UK, and from USA, and our Pakistani partners who are on this webinar. You know, we previously were victims of that if you didn't do anything in person, it did not happen. I think what the benefit of Corona is that we have all learned that it's a very small world. We can collaborate internationally and we can meet effectively and push our agendas forward, in a more timely fashion. So I think that's the silver lining of this whole Corona, that we are doing what we need to do collaboratively and together. So as Shahid mentioned, Merit has a long history, but 2020 has been a particularly, I think, the most productive year in Merit's history. We launched the family practice program starting with inaugural conference in March 2020 at Rawalpindi Medical University. And then to now, we have now 100 CME hours specialty-based family medicine curriculum developed, and we're delivering that on a weekly basis. And we have a group of people from Pakistan who are enrolled in that course, in the year-long course. There was the launch of APPNA Academy, and they have started courses, launched courses on movement disorders, stroke, of course, the family practice one, and then a point of care for ultrasound. And Dr. Danish Bhatti will explain these further. In all our deliberations last year, one of the things that came out was that we needed to strengthen the Pakistani nurses. So APPNA MERIT launched the nursing chapter. There has been a coalition of diaspora nurses in collaboration with Pakistani nursing leadership. And there has been a collaboration, again, an international collaboration and online courses for critical care, and other specialty nursing master's program has been launched, as well as community nursing, to complement the family practice initiatives. Our goal is that the primary health care should improve, and this is one of the backbones of any healthcare system. We have also started collaboration with the International Federation of Medical Students Association, IFMSA, chapter of Pakistan, so that we can involve the medical students in APPNA MERIT early during their formative years and mentor them to be leaders of tomorrow. New chapters of Merit have been launched or relaunched, like emergency medicine, nephrology, pulmonology, sleep medicine, so that now in Merit we have a full complement of specialty chapters. I remember Dr. Junaid Razak, I don't know whether you remember that in 2010, I worked with you because we realized that CPSP did not have an emergency medicine fellowship or a critical care fellowship. And we worked on that together as APPNA MERIT a decade ago. Obviously, APPNA MERIT is very proud, and APPNA is very proud for the COVID response that MERIT initiated with daily webinars. All in all, about 50 webinars were delivered in real time with Pakistani healthcare professionals dealing with how to take care of COVID patients. This is a small contribution to us, but it was a great response by Pakistani leadership, and hopefully, we can't take the credit, but I hope that APPNA and APPNA MERIT partnered with Pakistan in containing and treating patients with COVID, which has been a remarkably successful story for Pakistan. So again, I thank all the guests on this webinar, and particularly, wish everyone all the best. And I hope we are successful in launching the emergency medicine. Thank you.
Thank you, Naheed. Danish, you're next. Please tell us briefly about APPNA Academy concept and how will it work?
Thank you, Shahid. I think Professor Naheed already summarized much of what I wanted to say. So I will just add that in APPNA MERIT, one of the change in or shift in our approach this year or in the last 2 years, that is represented by APPNA Academy, is that we are more interested in wanting to do what we call structured courses. So things that are structured around a curriculum, an objective, a goal, a skill that we want to achieve, something where we are trying to get to. So rather than doing a random 1 hour educational event once a week or something like that, we sit down, we pull a team together of specialists, we think of what we're trying to achieve, who our audience is, what our objective should be, and we really develop a course out of it for the continuing medical education. As Professor Naheed mentioned, many of our courses that we're doing. And APPNA Academy is basically the online platform that we are starting to use more and more, what is called a learning management system, and LMS. And I think the only other thing I will add is that we are really appreciable for all our partners in Pakistan. And we have made a conscious effort that every of these courses that we build for our audience, we always have a stake in the game by our local partners, by experts in that field, and also our audience themselves. And we constantly learn and improve what we're doing. And we're looking forward to your guidance and advice. Thank you. Thank you, Shahid.
Thank you, Danish. Next is Junaid Razak, who's a professor at Hopkins and position, I think, in Yale as well as Aga Khan University in Karachi. Junaid has been very instrumental from the beginning. He was, in fact, in Aga Khan when he started the first ever ER program, emergency medicine program in Pakistan, and was the one who initiated the CPSP approval of this new speciality in Pakistan. So we are very, and he's already well known with Dr. Taj in UK, who has done equally wonderful things for Pakistan emergency medicine, and so it was easy to have these, and also Dr. Abdul Salam, president of Pakistan Emergency Medical Society, that it was easy to build that coalition because of these eminent emergency medicine academicians. So Junaid, please tell us an overview of your initiative, and then we'll come back to it again when we'll introduce the emergency medicine, the whole team, and discuss more about emergency medicine. At this point, please tell us briefly the overview, how you see that this program is going to take place.
Thank you, Shahid and Danish, for the opportunity. And of course, Professor Usmani, I remember us having a conversation many years ago, and I was right in the middle of creating this emergency medicine curriculum and CPSP. And I was not sure how we can benefit from their experience. But of course, as you mentioned, the world has changed. We now are much more comfortable with distance learning. And I'm so happy for this opportunity, and really want to thank all of you at APPNA. Also, my partners in crime, Dr. Abdul Salam, Taj Hassan, Farida, and others who have done remarkable work. And of course, Dean Adil from AKU, who continues to support the work we do in Pakistan. So let me just quickly take you a couple of slides. We all know why. We know about emergencies, disasters in Pakistan. We also know that there are two gateways to our healthcare system: emergency departments and primary healthcare system. And for some reason, both of these have become sort of over time, not very strong, perhaps weaker. And I'm so happy that the primary care program is moving forward on APPNA side, and I think we are working on that. But also, those of you who are interested in why Pakistan, if you look at the top 5 or 6 causes of death and disability in Pakistan: neonatal disorder, ischemic heart disease, pneumonias, diarrhea, road traffic injuries, stroke. All 6 of them are acute illnesses, and you really can't predict them. Of course, you can prevent them, but when the prevention fails, we need to have a system that can take care of these patients. And over time, we have seen that the numbers are increasing, especially trauma, especially ischemic heart disease and stroke. And unless we fix our emergency care system, we will not be able to be ready for the challenges we are seeing in the future. Also, there is, of course, the perceived need. If you ask people what is the #1 issue for their healthcare access, it is what's happening in emergencies. Another number, every hour in Pakistan, 30 people die of cardiac arrests and 10 people die due to injuries. Even if we can reduce that percent by 1%, that number by 1%, we will be saving 10 lives a day in Pakistan. So making an impact there, and it's not just about the numbers, it's about stories of people who live behind those numbers. There are many of them are young people. Many of them have smaller families, especially those who are suffering from trauma. And our healthcare system got to respond to the need we have. And then finally, I'd like to talk about what is APPNA MERIT, and some of us are doing. There are two main areas that we want to focus on. One area is how do we strengthen the residency training program through collaboration between Pakistanis living abroad and Pakistani training programs in many institutions where trainers are not yet well developed. And we started that actually yesterday, thanks to all of you, where we had online case-based clinical scenario discussion between a leader in clinical practice in UK and Pakistan, and I was representing US. The other area that we feel is much needed, and we'd love to hear your thoughts, is to train the existing casualty medical officers through our distance or hybrid learning program. And all of you who represent so many institutions, academic institutions in Pakistan, can help develop a diploma program or some sort of program where we can engage them and make a big impact. And finally, one thing I really would like all of you to help is to train Pakistani youth in life-saving programs, where I think we have a huge impact to make. And we as Pakistanis want to be known as nation of lifesavers because we're training our youth in this area. And this is based on partnership with institutions in Pakistan, with Pakistanis in the US, UK, Australia, and Middle East. So these are the three programs I'd like to pitch. Two of them we are committed to, the two in red, and one in green is already launched with a number of institutions that I'm going to show here, where we have partner institutions in Pakistan, our educational institutions, and we would like the government to really help us create the market for these through school and college curricula, through creating laws that will allow people to save lives in the streets so that we can all work together. And I think what I'll do is I'll stop here and give mic back to Shahid.
Thank you, Junaid. That was very helpful. So now I would like to invite our guest of honor, Dr. Faisal Sultan. As you know, he is currently the special advisor for Prime Minister on Health. And but most of us know him from Shaukat Khanum. He has a great track record of delivering and excellence, as he has proven. And we hope that with him being at the helm of affairs, and also because of his background training from here, from international exposure, and his pursuit of excellence, we will have more inroads as to the partnership and collaboration with Pakistani institutions and King Edward, RMU, all the best of the institution in Pakistan. But the logistics, how we do it, is the key. So Dr. Faisal, please give your keynote.
Thank you. It's very kind. Especially grateful for your very kind words. And that also sets me up to make sure that we do deliver instead of talking. So a little bit about emergency medicine and the challenges of setting up new specialties. I'm only too aware and went through similar stuff myself for setting up infectious diseases. And for many years, I can tell you, 6 to be exact, we struggled with trying to introduce the idea of a new specialty. And I think it was with Khalid Gondal's arrival and the present leadership at the CPSP where all of a sudden we got three, in fact, then later on many more specialties that got added. And I think there was realization of the fact that many of these areas areas of medicine which have been taken for granted, in the sense that generalists or those people who felt that these could be tackled without necessary specific training or background, had caused a situation where we did not truly have experts. So I got introduced to Junaid, then others in this whole process along this last decade. So I think that there is centrality to these two areas, which both of which actually end up getting a bit neglected: emergency medicine as well as primary care. And the experiential part of medicine for most people in the largest volume is indeed in these scenarios where you arrive either somewhat unwell or quite unwell. And that's where our experience of how we are treated in healthcare ends up being. And in fact, because of the urgency of many of these in the emergency setting and the preventability of many of these in the primary care settings, we lose tremendous opportunities to do or to make a dent. And then in the end, some of us end up trying to sort out things once they're past that acute stage, and it's much more difficult and an uphill battle, as we all know. So I think one good thing is that both these areas have focus now, and predictably and understandably, APPNA and MERIT have focused in these areas, because I think they do know where the greatest gains are in intervening. A bit about the government's priority. We set up, some of us got together and set up a set of priorities long before the present tenure. In fact, somewhere around 2011 and 12, in what ought to be the things that the government of Pakistan ought to be doing in terms of providing better healthcare. Again, because of the Prime Minister's association and inherent centrality to Shaukat Khanum, he was only too aware of the need for better healthcare for the public, both preventive as well as curative. So I think that formed a very, very important part of the agenda of the present government. Now, I'll quickly step into a little bit more tangible and specific things. As far as the Federal Health Ministry is concerned, as some of you know, for a while it became non-existent. And so it's been clawed back from non-existence to existence. And its current role, because of the devolved 18th Amendment, really is primarily regulatory and that of coordination across the provinces, and a little bit of healthcare delivery for federal territories. So the important levers it provides to impact on which direction healthcare goes are primarily through those regulatory pivots. So we are in the midst of a complete regulatory overhaul of how physicians, medical colleges, nurses, nursing schools, pharmacy, the Drug Regulatory Authority of Pakistan, and the NIH function. And you will see a number of laws coming back to back to address the changes that are required. There's a lot of anxiety as well associated with some of this. Some of it is understandable, because as you change from one paradigm to the other, then there are obviously concerns. But these are also exactly the pivots and the levers that provide the opportunity to make a change. So for example, we have the college represented here by Dr. Gondal, but the CPSP, while completely independent as an organization, is one of the associated entities that work with the federal government. So they're already well on their way to actually having this specialty and training people. But I think that a little bit more needs to be done, especially from the end of PMC, where the undergraduate medical curriculum really needs a redo. And I'm very hopeful that the new PMC will be able to bring it about. Inshallah, as of this coming Tuesday, when we have the next cabinet meeting, we will have the academic board in place. And I do see some names or faces out here in this webinar as well, who will be in there, inshallah, hopefully. And so to really bring our medical education to the present time, really. And I think that is one of the most important ways to influence how our future generations are trained and educated. And not just amongst physicians, but also amongst nurses, allied health professionals, pharmacists. There isn't enough time for me to actually tell you every little intervention that's either in place or about to be in place, and some of which will be more obvious after March, when the government has a majority in the Senate to enable better passage of legal reform. So these are some of the very sort of high-level interventions that do exist in making a difference. I also want to speak very briefly about being able to bring in the help of the diaspora. When Naheed and I had the privilege of working together in Shahid Rafiq many years ago, there was a platform that the Ministry of Labor used to use to bring in Pakistani expertise from overseas. They had essentially a list of names that was thrown around to institutions, and you could pick and choose, and people came in. But this was before the era of good connectivity and the ability to do learning remotely. I think, but even then, we were able to bring in people who helped tremendously for setting up, for example, our basic sciences laboratory at Shahid Rafiq. I do remember that our IRB got set up by such an intervention. And so now I think this is much easier too. And I think, as Naheed mentioned, with the coronavirus epidemic, I think anybody who had any shyness in or disbelief in how this can work, I think most of it is gone. So the Yarane Watan program was part and parcel of this. It's taken a little backseat in this process, but I think we are now at a point where we would be able to power it up and get a lot of additional help in terms of bringing in expertise from Pakistanis mostly, but all across the world, and in all of the countries which are currently even represented in this webinar. I think that beyond just webinars, it also provides an opportunity for people to see where expertise does exist and where it can actually be deployed. An exchange of expertise, if you will. So I think I really think that this has made a difference. This present challenge has made a difference and made us all, I think, believers of the fact that we can do this, in a mix and match way, some from a distance, some perhaps from close by. I'll close by something very specific. And while many of our tasks that the ministry has in delivering to the Prime Minister or to the government are of a strategic nature, by the very nature of the Federal Health Ministry of National Health Regulations, etc. But not surprisingly, one of the things that he keeps reminding me of, and I jokingly tell him that you've got a gun on my head on this, is healthcare delivery within Islamabad. And so one of the things that we picked up, and I had help from Dr. Abdul Salam in this, was to try to upgrade the emergency medicine flow at PIMS. No real investment, virtually nothing, I think, but just a change on how people arriving with emergencies at PIMS are handled, triaged, processed, sent different ways. And so as part of that, we got help, and we are quite coincidentally, completely unrelated to this, but completely coincidentally, this coming week, we'll take the Prime Minister down to the emergency and show him how, with very little interventions, you can make a difference on how fast and effective interventions can be put together. So I'm really honored and grateful to be here, and I am delighted that this area is being addressed and tackled. But before I sign off, one more thing, which is close to heart of everyone, especially MERIT and APPNA, which is primary care medicine. You may have seen that we have finally gotten consensus with all the provinces on the package that is going to go into universal health care delivery. It's going to cost relatively little. It's about $12 or $13 per head. per annum, and has a set of 88 specific interventions at the primary care level that will make a major difference and dent in people's lives all across. For this, we will require partnership, not just in the government sector, but with a whole swath of primary care practitioners and providers. This is a step that's a bold one, but people have shied away from it. But inshallah, we hope that we will take it. Thank you very much.
Thank you, Dr. Faisal. It was wonderful. I would like to acknowledge here that Usman Mushtaq, who is the lead for Yaran Watan, is also here, and we are very thankful to him. We have been involved with Yaran Watan from the inception, from the time that it was conceived and the initial meetings. And Dr. Naheed, our president, actually went and attended the first meeting. And so we hope that this program gets more teeth and more, concrete steps sooner rather than later, and so that all the international medical diaspora can play their part. Another thing that I was picking up on Dr. Faisal's PIMS initiative was that the ER group, as I was discussing with the ER group and Junaid, they have a plan to similar way in kind of capacity building of different institutions to modify their flow, because as you know, the workflow and the protocols and the this is so important. The triage, the way we do it, even in stroke, picking up, I know IVTPA, I'm a stroke neurologist, but is not as available in Pakistan. But that is the main issue that I deal with the ER on a day-to-day basis, how they miss triaging a patient with a stroke alert or IVTPA candidate. So there are many, many ways where the triage is so helpful in all these methodologies. So they will be working on them. So now let me involve our Pakistani medical education leadership. And I'm sorry that I think Dr. Adil Haider, I had planned to with the permission of Dr. Khalid Masood Gondal, put him earlier, but he had to leave. I thought he had 30 minutes, but he had 15 minutes to attend another meeting. So we will start with our very, dear friend of Merit, Dr. Khalid Masood Gondal, very eminent medical educationist who has actually 2 portfolios, one in CPSP and one, of course, as the Vice Chancellor of King Edward Medical University. So Dr. Gondal, please tell us, as we have already talked with you in many programs, and King Edward is one of the institutions which is very forefront in this collaboration. Tell us more about what you see, how international medical diaspora can collaborate, and are there, what is your vision and concrete steps towards that? And also the emergency medicine.
Thank you very much, Dr. Shahid Rafiq. I'm sure everybody could listen. I mean, आवाज़ मेरी सब तक आ रही है उसमें.
Right.
I'm very grateful to the APPNA MERIT for inviting me on this very important topic. I think this is very important specialty, a new specialty emerging for the last 2 decades all over the globe. And I've got a special interest in the development of this specialty. And I think today's webinar is a way forward to the expansion of this specialty in Pakistan. And I first time visited in 2008 College of Emergency Medicine, UK. And I had the meeting of the then president. Our college को फिर royal status मिला in 2011 में. अगली meeting 2011 में हुई. Then I had a meeting with the Dr. Taj, who is, I think, attending the conference today. He was the president, Royal College of Emergency Medicine at that time. And we have 2 international conferences on emergency medicine. And I also visited the Wigan Hospital of Emergency Medicine and St. James's just to develop this very important specialty in Pakistan. And I must acknowledge and recognize here the services of Dr. Junaid Razak and Dr. Abdul Salam. These were the 2 people who started this specialty in Pakistan. And by the grace of Allah Almighty, you will be glad to know that currently the number of the approved supervisor by CPSP, they are around 35, and 137 trainee, they are registered. Already 10 plus people, they are qualified, and more than 10 places, they are recognized for emergency medicine. But as far as the need of the specialist concerned, the number of the training side, they are far less. Similarly, the number of the trainee, they are far less. We are currently having around 30,000 trainee on university side as well as on the CPSB side. But this specialty is not having that much number of the trainee which are required. Now, as far as King Edward Medical University is concerned, you will be glad to know that King Edward is the only public sector institution in Punjab which is recognized both by the college and by the HEC and by the university for emergency medicine. और इसमें भी मैं credit देना चाहूँगा current government, Professor Dr. Yasmin Rashid, and of course Faisal Sultan and current Prime Minister की vision. They wanted that professors should be available in the emergency. मेरे साथ इसका Professor यार मोहम्मद तशरीफ फरमा है. He is Professor of Emergency Medicine, and we are making sure that the professor, associate, and assistant, they should be available in the emergency on the pattern of the Wigan's Hospital and St. James's Hospital and your hospital, and similarly from Australian Hospital, Majid Gondal यहाँ मौजूद हैं. Currently इस वक्त शायद साहब हमारे 14 trainee, they are undergoing the training both on the university side, MD and FCPS program, and we are having the refresher courses already on. और इसमें जो हमारी 2 इंटरनेशनल कॉन्फ्रेंसेस हुई हैं वो 25th 27th March 2019 को हुई, जिसमें 550 people they participated. Then we had hybrid model of second international conference जो 9th to 11th March 2020 को हुई. इसमें I think over 1000 people they participated online and they were there. So इस अंदाज में ये एक स्पेशलिटी है जिसको कॉलेज ने पिकअप किया. King Edward Medical University we are trying to contribute, and I think you have picked up this very important specialty, और अपना merit की collaboration के साथ will be able to expand and develop specialty this specialty. और अगर फैसल साहब इस वक्त मेरी बात को सुन रहे हैं तो मेरी उनसे ये भी रिक्वेस्ट होगी कि पब्लिक सेक्टर KPK में they started in LRH. In public sector, we have started at King Edward Medical University. Why not all the tertiary care centers should have this specialty program compulsorily, at least at the tertiary care center? Thank you, Dr. Shahid Rafiq. And if you I've got any question to respond, I'll be there. And again, I'm very grateful to you, Dr. Naheed Usmani. You always invite me, you involve me, Dr. Danish Bhatti, और इनके साथ आपके रिजवान खालिद प्रॉबली प्रेसिडेंट इलेक्ट हैं, और मेरे कोलीग्स मौजूद हैं इस वक्त, तनवीर खालिद, प्रोफेसर उमर, प्रोफेसर इकबाल और डॉक्टर फरीदा ख्वाजा एंड प्रोफेसर ताज हुसैन को देख के मुझे बहुत खुशी हो रही है. इरफान मौजूद हैं, और लास्टली मैं अगेन आई विल बी ग्रेटफुल टू डॉक्टर जुनैद रज़ाक एंड अब्दुल सलाम who are the pioneer of this specialty in Pakistan. Thank you, APPNA MERIT. Thank you, Naheed Usmani. Thank you, Shahid Rafiq and Faisal Sultan.
Thank you, Professor Gondal. It has always been a pleasure to have you in all of our program, and the way you cooperate and lead us and guide us. Next is my dear friend and senior colleague, Dr. Professor Muhammad Umar. And full disclosure, I'm from Rawalpindi Medical University. And I'm very proud how Dr. Umar has taken this to new directions. And I know personally that he started an emergency medicine program I think 2 years ago, and we did some fundraising. He always push us to hear our alumni to raise some funds for all the initiatives that he do. And I'm very grateful for his presence and always guiding us. He's also a great friend of APPNA MERIT. So Dr. Umar, please go ahead and give your comments. Dr. Umar, are you muted? Or,
yes. Can you hear me?
Ji. Go ahead.
Okay. Bismillah ar-Rahman ar-Rahim. Thank you very much, everybody, and particularly Dr. Shahid and Dr. Danish and APPNA MERIT team for inviting me and asking me to join this noble mission. I'm also a very warm welcome to the Bhardi Health Minister and rest of the colleagues. Uh, I think Rawalpindi Medical University is a just 3-year-old. So I will give you a short review what we have done and what is the vision of the leadership regarding this healthcare systems. Rightly pointed out by Dr. Sultan that there are two gateways to the patient. One is the emergency, which is obviously dealt in the hospital, another is the family medicine. Alhamdulillah, Rawalpindi Medical University is working on these two horizons. Shortly, emergency in 3 years, we have established an emergency department. This is the basic requirement. And second to this is the emergency programs. And third is the emergency faculty, as mentioned by Professor Gondal Saab. There are two, routes of following the postgraduate education. One is the fellowship, another is the universities. So as I was mentioning, it's just 3-year-old program. So this is not Gondal Saab only in the Mayo. I think the Rawalpindi Medical University and its affiliated hospital has established the university residency programs also, and created the cadre. And now we have assistant professor employed in the university. Unfortunately, हमने इसको किया था advertise, but we still not available with the professor and associates. So we become the second who have the dedicated emergency faculty to supervise all this. Coming to the program, we have the first to start the emergency medicine foundation programs. I think this is the first connection with the international diaspora. And not only in Pindi, but we become the first in the Pakistan to start this program. I think Dr. Taj is here. He visited university a couple of times, and I mentioned Dr. Basi here. So we have, alhamdulillah, just completed 1 year of this emergency foundation program. I think which will be the pivot to the whole country. We have trained about 30 primary physicians at the what is called the CMO here, which are now doing the triaging in the all 3 hospitals of Rawalpindi Medical University. So I think we have just started the ball rolling in a practical way and not only planning and suggesting things. Secondly, we have evolved a residency program in emergency medicine, and this programs and curriculum is everything designed, and the Punjab government has allowed us to start this residency program of 4 years. And we become, I think, after King Edward, the second university to start the 4-year residency programs like the many American programs. So this is how we are proceeding. And we have already advertised the post second time. And inshallah, as we get the residents, so this will be the established program in Pakistan and take the visions of international diaspora. And I'm again grateful to Dr. Shahid Rafiq, who is the part of RMU alumni, all the time pushing it and supporting us. Coming to the family medicine, again, the university has completed 2 courses of certificate family physician courses, which is 6 months. This is the first thing. We have already designed the curriculum for the diploma in family medicine and 4-year residency program in family medicine. And Dr. Shahid, we have already advertised the post of assistant professor, family medicine, and inshallah, in December, when you visit RMU, there will be a dedicated department, faculty, and inshallah program of family medicine diploma and residency. Lastly, I think again I appreciate Dr. Faisal Sultan that the Pakistan Medical Commission has given us the permission and letter that we can start all these residency program in critical care, infectious disease also, and obviously which is very near to the heart of our worthy minister, and emergency medicine. And this is the all we alhamdulillah doing in a rapid pace of 3 years with the support of APPNA and our other colleagues and the Punjab Health Government. I think we need your support, and we thank you for involving the Rawalpindi Medical University on this forum. Thank you very much.
Thank you, Dr. Umar. Now, moving on to our another great supporter, friends, collaborator is the Pakistan Army. From Surgeon General to different deans and Director General We have great collaboration. We have a great ask and working relationship. So I'll invite my friend, Director General Medicine in Pakistan Army, as well as Dean of Medicine in National University of Medical Sciences, Professor Imran Fazal. So please give us brief, collaborative efforts and the way forward. Thank you. Imran?
Assalamu alaikum.
Gigi,
Dear
go
colleagues,
ahead.
it is a matter of privilege for me to be on this August Gatherings Forum. And there are so many friends sitting. And I believe that emergency medicine is the way forward, the way our patients are tackled in the emergency level. And APPNA has started very useful sessions on various subjects, and especially emergency medicine remains one of the pivots. As far as Pakistan Army is concerned, we are spanned to different units all over the country, and we are a set of about 42 hospitals all over the country. What we have been doing is that we have been started our training of our human resource right from the grassroots level, from our nursing assistants, from nursing officers, and then to our medical officers in the form of basic medical courses and then advanced medical courses. And then with the help of CPSP, we are also part of the emergency medicine fellowship program. But what is most exciting for us is the way forward which APPNA has created for all the professionals of this country, and as well as for our residents, that this is what we precisely require. And now with your expertise from all over the world, I think this is going to be a way forward, and this is going to be a very, very successful model, which at government level, with the vision of Prime Minister and with the dynamic person like our leadership, I think this is going to be a way forward in Pakistan's history, that our emergency medical services are definitely going to improve. Once again, I'm thankful to all of you, and my other colleagues are sitting with you as well, and specifically my colleague from the surgical colleague, General Irfan Sheikh, is here, who is the Director General of the surgery, and he would highlight the traumatology part of it and how we have been doing it. Thank you very much.
Thank you. We are lagging behind a little bit, so I would like to expedite. Next is Dr. Professor Irfan Ali Sheikh. He is Director General of Surgery as well as Dean of Surgery for NUMS. And so please tell us about disaster management, because that is also something that our ER group, particularly Junaid Razak, would like to take up, I guess. So tell us more about that in briefly. Thank you.
Oh, thank you very much, Dr.
Shahid.
Shahid, yes, sorry. And I'm really grateful to APPNA MERIT for inviting me here, and also that we have already collaboration for so long. You have been very supportive to us in Army Medical College also, then NUMS, and then now in multiple fields, including emergency medicine. This was a very difficult job to start with emergency medicine in public sector. And Dr. Masood Kondal and Dr. Professor Umar and others, they tried very hard to introduce it. But I think my special gratitude goes to Professor Abdul Salam and Khwaja Junaid. They had a will, and they always thought of this thing that it should spill over to the public sector. Initially, it was in the private sector, and they worked very hard with Pakistan Army, and I'm really grateful to them and also CPSP to introduce this program after a period of about 5 years of struggle, running short courses initially, and then shifting to fellowship program last year. And now we have, alhamdulillah, 5 trainees from Pakistan Army and 4 trainees from the civil side also. And we will, inshallah, increase the number next year for 6 trainees per year from Army and 6 trainees from Civil also. As far as the progress is concerned, we are very again grateful to Shifa International Hospital. We have full-time collaboration with them. Our trainees and their trainees have they have exchange program also, and we also tend to send our supervisors there because we don't have a dedicated supervisor in EM. We are trying to have the services of some specialists in EM, and recently doctor was referred by Professor Abdul Salam also, and hopefully she will be joining us in the month of April. So thank you very much that Dr. Shahid, you are providing us this forum also, and APPNA Merit is helping us as usual, and I look forward for a good progress in Army also, and spilling this program to all of our hospitals in Pakistan Army. Thank you very much.
Yeah, thank you, Irfan. So next is my friend, Dr. Tanveer Khalik. He's very dynamic, young Vice Chancellor of Shahid Bhutto University, and of course, being in the Federal Territory, works, I think, more closely with Dr. Faisal Sultan and the federal government. And I should mention that he has been very, very supportive of many of the merit initiative, particularly the nursing and the other initiative, family practice, which RMU also has been very progressive. So we have two partners in nursing initiative with Shahid Zulfikar Ali Bhutto and RMU. So Dr. Tanveer, go ahead and let us know about your vision and collaboration.
Thank you, Shahid, and thank you mentioning the word young. Very encouraging. Most of the things, they are already highlighted by Professor Gondal and Professor Umar, and of course by Imran Fazal. But I think let me discuss the issues. What are the problems in ER department everywhere in Pakistan? Just to mention PIMS, we receive around 1,500 patients per day, and which is 600,000 patients per year, which is a huge number. And we have only 106 beds in ER. So we have to look into this very important issue, that how we can increase the number of beds, how can we increase the number of facilities in district general hospital and tertiary care hospitals. So that these are the issues, number of patients. Then what is the way forward? I think there is no doubt that there should be a proper teaching setup in emergency medicine. We should have departments with the professor, associate professor, and assistant professor. And though there is Pakistan, and the way CPSP is working, and we are going to get more consultants in this field, I think the link which we are missing is nursing cover for ER. Most of the things can be done by the nurses. If Irfan Akhtar is here with me, he will second me that majority of the ER departments in the UK, they are backed by the nurses. They call them ENP, emergency nursing practitioners. So we have to address that area as well. And of course, we are working on that. Then we don't have strong paramedics training. Paramedics, they're a very important part of emergency department, and we have to address that. We are also working on that, and we have started 2 years program for paramedics in emergency department and emergency medicine. The fourth point is pre-hospital care. The care which is given in ambulance at the site of accident, and then during the transfer. That is a very important area which is missing link in this area. And of course, we need a uniform across the country structured training program. And just to second Professor Umar and Professor Gondal, the emergency medicine fellowship should be across the country, and we should recognize more and more emergency department for FCPS training. Emergency fellowship, our MD program in our university is in its second phase. We have passed out first batch, and the irony is that 4 of those specialists who qualified MD emergency medicine from PIMS, they left the country and they are in UAE or in the UK. So they leave very quickly because they get more money in Middle East and in Saudi Arabia and in the UK. So they leave very quickly. And the second batch of emergency medicine program in PIMS is on the way, and they are going to pass out next year sometime. So the total number at present in emergency department in PIMS, they are 8. So we are going to increase the number, but we need more supervisor, of course. Then, as Professor Dr. Faisal mentioned, that we are working on a very important and care system in ICT, Federal Capital Territory. We are working developing in the various dispensaries and BHUs in the capital, and we are trying to link these dispensaries with the PIMS hospital and one more hospital, which is Federal Government Services Hospital. So we are trying to develop that linkage, and I think that is going to improve. So we are at the start, and hopefully with the supervision of our federal minister and the current administration of PIMS, we are going to develop a very smooth system of emergency medicine in our hospital. And just to mention the new setup which we have adopted in PIMS is the triage, and we have set the priority. The very close part of the emergency department, which is very close to the main gate, serves as a triage area from where we direct the patient to the various other areas like cardiac emergencies and burn center, or to the main hospital or to the children's hospital. So that is a very important step, and that has very nicely streamlined the flow of the patient to the hospital and emergency department. So I think with these initiatives, it is going to improve, and we are working together, and APPNA support is always very welcome at PIMS. And I think Shahid, we will move forward, inshallah. Thank you.
Thank you, Tanveer. Since I consider myself young, and you're my class fellow, so we both are young. But again, I appreciate really the point that you raised about the nurse practitioner as they work in UK, and here in United States, how the nurse practitioner's role has evolved, and how they fill the gaps, which of course in Pakistan are many. So I'm sure Professor Faisal Sultan also is very aware of and I'm sure he's supportive of the nursing specialty cadres, whether they are nurse practitioner or critical care nurses or ER nurses. ER nurses will be specially trained I'm hoping by this group, if that is the direction that this group needs to take. So finally, in this group of medical education leader, I have Dr. Iqbal Khan from Shifa, and I really appreciate Shifa lending its hand to not only the, being a private institution, they are so generous in supporting the sister institutions in the region as well as others and Pak Army. And we have worked very closely with Shifa. So Dr. Iqbal, please go ahead and give your comment briefly.
Thank you very much. Thank you, APPNA. I'm absolutely honored and privileged to be invited in this very august gathering. Shifa is one of the pioneer institutions in Pakistan. Aga Khan and Shifa were the first one to start the emergency medicine. I'm thankful to Dr. Junaid and Dr. Islam. Dr. Islam is also here today, and I don't see Dr. Junaid. He might be somewhere around. And these were two people who started in the north of Pakistan this program, and alhamdulillah successfully run it. And we have trained several emergency physicians who are working not only in Shifa and other places as well. And they actually developed the indigenous contextual program for the emergency medicine. And thank you very much for Dr. Gondal and his team who actually recognized their efforts. And alhamdulillah, this department is now one of the pioneer in Pakistan, and not only helping the army. We are willing to work with all the other partners, and this is the time where we need to work together and develop a collaborative contextual emergency program which should be comprehensive for our country. And I also believe that Shifa is now able to extend its helping hand for the others, and we are very much willing to extend our services and our expertise and help the other institution to develop. We need to develop the emergency program at the district level as well. I said earlier that there are two gateways, the emergency and the family medicine, and I strongly believe that if these two departments are strengthening, then we are strengthening our medical services in Pakistan. And secondly, it was said earlier that the nursing education is very important. So Shifa took the opportunity to establish the nursing master programs in critical care. We have graduated several graduates from here in masters in critical care, and now we are in the process of starting a master program in the emergency medicine as well. And the PhD program, the Shifa is one of the probably the first institution in Pakistan starting the PhD program in nursing, and we need this nursing faculty in Pakistan, and it's very important that we train the comprehensive specialists, not only the physician but also the nurses as well. But I suggest that the APPNA MERIT can develop a hybrid or blended program for the emergency medicines quickly developing in Pakistan across the country. And this blended programs can include both face-to-face and the online programs. And online could be asynchronous or asynchronous. And I think the APPNA MERIT can contribute a lot in the specialist sitting in UK, US, and other places. They can contribute to their country, and inshallah, this program can quickly spread all over the country. I request the leadership of particularly Professor Gondal and the leadership of CPSP to please recognize this program as a blended program, as the many institutions like Shifa and other institutions, we develop a contextual and blended program in for the undergraduate as well as for the postgraduate. And I think this can be a good example, can be replicated anywhere in the country, and we are willing to contribute, and we are willing to collaborate with all the other institutions in Pakistan. And by this, I appreciate that the APPNA MERIT has started this program. And the next one, I will request you to concentrate on the nursing as well. And I just want to inform you that Shifa is working on the comprehensive healthcare system, and therefore we have started 2 years program for the technologists and a 4 years program for the technologists, including the emergency medicine and other specialties as well. And we can also share these programs with the other institutions who are in the process of developing these programs as well. Thank you very much indeed.
Great, thank you, Dr. Iqbal. It was very insightful and helpful. I think this journey will continue. Now, we are, towards the end of the program, but the most important is this collaboration that has been created with our partners in UK and Australia, and they are here, and I want to give them ample time also to introduce themselves and the program ER in itself a little bit more. And to start that, I will invite the president of the Pakistan Society of Emergency Medicine, and as you have heard, he's one of the pioneers in this important field. And I'm very grateful to him, as well as Dr. Taj and Junaid, that they have formed this group to really work together, and that's the way forward. The coalition, collaboration with Pakistan International. And also, Dr. Abdul Salam, if you, you will tell your opinion, but I have a request that if you need a region to adopt, I think that's where you are, where the You have seen the Army, you have seen RMU, how interested that is. You have seen Dr. Tanveer Khalik, PIMS, and Shades of Karali Bhutto, and you yourself in Islamabad. That Twin City region can be a model for ER development if your group so choose to do. So please give us your input, Dr. Abdussalam.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much. I will try to be very brief. I know we are over time. So I will not go into detail of anything. I was listening to everyone and I was very thankful that the journey that we started like a decade ago has gone so far that we are having this big collaboration of learned people thinking about emergency medicine. For 10 years ago, it was not even seen anywhere in the canvas of Pakistani healthcare. What we tried to do in last 2 or 3 years, especially working with the international diaspora, especially from Australia, UK, and USA, making friendships and trying to bring people to Pakistan. Zoom is a very best way of a follow-up training, but people have to come to the groundwork and work like the foot marchers to understand the reality of what is actually needed. So just to give you a hint, that when I was asked by Dr. Faisal Sultan about one intervention that we would like to do in any emergency department across Pakistan. So we chose, like especially in PIMS, we chose the triage because we know most of the problems that arise in the hospital that lead to a disaster in terms of people beating each other, people beating healthcare professionals, is especially when a patient gets neglected, the patient that was actually sick and was not seen in time. So one intervention that we chose at that time, and I still believe, and I would request Dr. Faisal Sultan, because he is sitting in the federal, to choose triaging as a means that everybody who presents to any emergency department across Pakistan needs to be properly triaged. That's the one intervention that can save more lives than anything else that you can do. So this is one of my comments that I would like to have. Another thing is, if you, we have talked about emergency medicine and from different angles. I will put one more angle to it. We have done this study multiple times among ourselves, and we came up with one number. Dr. Junaid talked about different numbers in Pakistan. I'll give you one more number, and that is the number of emergency medicine trained specialists that we need in order to run all the emergency departments across Pakistan effectively. And we portrayed this number to be around 16,000. And now, if you remember, Dr. Gondal have said that we have, alhamdulillah, 135 trainees in different emergency medicine programs. So you can do math yourself. How long would it take for us to reach the number that is a desired number, which is 16,000 trained physicians? At the rate of 135, probably it's going to take much more than a couple of centuries to reach that level. So this means we have to do something other than just the 4-year or 5-year training. We have to also train the people who are already working in our emergency departments and not in the training program. And this is where I would like the APPNA MERIT to focus. Focus on people who are not in a training program. Focus on people who are working in the emergency departments, providing the care, and also they are not trained properly. So they are the ones who probably feel they are stuck. And if APPNA MERIT, with the help of Pakistan Society of Emergency Medicine, tries to create a program for those people, I think that would be a very quick fix to a already broken system. Dr. Faisal also talked about one more thing, which was that how less costly our intervention in PIMS have been. We also would like for the country such as ours, which is resource poor, to have an intervention that we can afford. So teaching the already stationed people in different emergency departments is much more cost effective than trying to build up the stream of very young people and training them for 5 years and let them come to the emergency departments. Probably would be much more costly and would not reach that goal that quick. With these two comments, probably I will stop over here because I can go on and on and on. I have like 50 things in my mind I can put to the task, but I think these two interventions probably would be very quick fixes to a long-standing problem. Thank you very much.
Thank you, Dr. Abdussalam. I am sure that's a sign of a true leader that has so many ideas and so many things to do, and obviously we try our best to do all of them. And I second you. I think that's why we introduced APPNA Academy, because that's my request to the International Coalition, as well as you, that this should be the next project of the group to come up with a blended online course for the non-EM physicians who are working as an EM physician, but they are not properly trained. So I think that would be really, really helpful. So next is our the lead for emergency medicine in Pakistan Army, Dr. Nadeem Ashraf, who already started working with this group, and they had a pilot program yesterday. To please briefly speak for a minute.
Sir, thank you very much for inviting me. And since my DG and DG surgery have already spoken on behalf of the Army, there is not much for me to say. But I will second Dr. Abdussalam. Whatever he has said, it is mandatory. The triage is very, very important. I have been working in emergency for the last 2 years. And this is really the problems which have been highlighted by Professor Abdussalam. I visited his hospital as well, and they need to be addressed. And the second thing is that what Dr. Junaid said, that this program or emergency treatment or CPR or BLS program should be initiated at the grassroots levels, and the citizens or students coming out of the colleges or universities, if we start this program at that level and we teach the students how to give a CPR and do a BLS, that will be most beneficial, I think. And this is how we can train the teachers and the paramedical staff. That is, the paramedical staff is in the hospital, but the emergency means that emergency is an accident. It can happen anywhere. And most of the people, they die because nobody has the training in CPR. And Dr. Junaid has rightly pointed out that if the first person who has seen the person who has gone unconscious, who has gone into cardiac arrest, if he starts CPR over there, instead of picking him up and putting him in the car or in the ambulance and bringing him to the hospital, if he knows a bit of CPR and starts chest compressions over there, that will be most beneficial for the person who has suffered this attack. Otherwise, the other thing is that I would like to thank all of you. I feel proud and I feel privileged sitting amongst the galaxy of stars. This is my first opportunity. And I would like to thank APPNA and Merit for giving us the opportunity to present the case yesterday. It was successful, and we would like to continue that with the APPNA and Merit. I will not take much of your time. I know we are going over time. And thank you very much. Thank you. And
thank you.
That's all from me.
Yeah, thank you, Dr. Nadeem. We really appreciate you guys staying a little over time, but it is important to now bring in our collaborator partners in UK and Australia, and I would like to invite my friend who's from APPNA, the organization in UK, General Secretary Irfan Akhtar, who will then introduce Dr. Taj Hassan, the lead from the UK, for this whole collaboration. And so, Dr. Irfan Akhtar, please go ahead.
Thank you very much, Shahid. Can you hear me?
Yes, yes.
Thank you, Shahid, for this invitation, and it's a great privilege to be in this such auspicious gathering of big academicians, but more importantly, many of them being my teachers. So it's kind of, it's great to be amongst us. I just could not help the zeal and the enthusiasm for emergency care, both here and across Australia, UK, and USA, and back home in Pakistan, which is one thing which I missed when I was training down there. I would just be very, very brief in my, few concerns, a few things which I wanted to take up is, I couldn't notice Junaid's point of 2 points of entry into the wards for patients, and how important it is to get it right. I mean, being an acute consultant myself, I cannot overemphasize the importance of a viable working emergency department. Otherwise, the type of load I would have to see, or my juniors have to see, would be immense or unmanageable. But we are thinking now in UK about the third route, and that's called as Think 1-1. And that is all based on reducing the workload on emergency physicians, because as we know that it is a wonderful place while you need it, but it's a very unsafe place if a patient overstays down there. And it's all around pivoting around getting it right first time. So that is something which, Dr. Abdul Salam, who very rightly mentioned about the resource poor country like Pakistan would benefit. And I can see that, be very useful for patients in PIMS or my own place, Rawalpindi Medical University. So that would be a wonderful, thing to think about. Just to give a brief preview of APPNA, we are about 12 to 13,000 doctors in UK registered with Pakistani heritage. And we are the only democratically representative body of not only doctors in UK, but also across in Ireland, which have got about 3,000 to 4,000 doctors. But now our membership is now gathering up to Germany, Sweden, and Norway. So we are expanding quite exponentially. We have got about 7,000 followers now as we speak. But most, encouraging for us is our junior doctors, who are about 300 of them, who are, looking for the opportunity to come to UK and ask questions. So that is what APPNA is providing. And it would be great to not to mention the contribution which APPNA has already made to emergency care. My colleague Taj, who's going to be talking to you soon, and Ayaz Abbasi has started the foundation program in Rawalpindi Medical University, which has produced the fundamentals or the basic foundations of the foundation doctor curriculum, which has been overseen and being monitored by the Royal College of Emergency Medicine. I think this is going to go a long way in producing the interest, as I see that there are not much of interest in emergency medicine, but also a pathway where these doctors can then nurture into becoming consultants in emergency medicine. Just for the sake of time, I wouldn't take any further. Please visit our website. That's www.appna.uk to see what we are doing. It is without further ado, it's my great privilege to introduce Taj Hassan, a very worthy colleague who is the immediate past president of the Royal College of Emergency Medicine. And it gives us great pleasure and pride to say that he's the first Pakistani to ever be a president of the Royal College. He's a consultant in emergency medicine, a Europe chair, a board of Internal Federation of Emergency Medicine, chair of the International Committee of Pakistan Society of Emergency Medicine, and is the co-organizer of the virtual meeting of Pakistan Society of Emergency Medicine, which is going to happen in January 21 in the coming year. So I would hand it over to Taj, please.
Thank you, Irfan. Assalamu alaikum. It's a real pleasure and honor to join you all. Thank you very much to APPNA for the kind invitation. It's lovely to see so many good friends, old friends, people who I've met in recent years and have been so supportive in Pakistan. At RMC, at PIMS, in Lahore, Professor Gondal. It's a real honor. So I obviously only have 3 points at this stage. I appreciate that it's been a long call. My 3 points are that I've been a doctor for 34 years, and of those 34 years, I've been trying to, in some small way, help Pakistan. I was born in Pakistan and have a constant guilt trip for to help the country of my birth. I've been trying to help Pakistan in emergency medicine certainly for the last decade or more. And I think it's a long history that Pakistan has, started by the likes of Junaid Razak. And there are islands of excellence, there is no doubt. But Pakistan, those islands of excellence in emergency medicine are small. The reality is that we have such a fantastically talented and agile medical and nursing workforce in Pakistan, but we've been very fragmented. And so my enthusiasm to help was really to help those in Pakistan in terms of supporting their leadership and supporting with advice and guidance, and in any other way that I and many others, just as this forum is doing. I think the second point I would make is that when I became president of the college, it was obviously an even greater pleasure to be able to try and support ways in which we could bring some of those disparate pieces together. And the international conference that we ran in 2017 that led to the formation of the Pakistan Society Emergency Medicine was a great step forward. In 2019, we ran a leadership summit in Islamabad, which led to a roadmap for emergency medicine, and that we had a special guest, Dr. Nashran Barki, who guided us through some of that. And I think we're very keen to continue that roadmap of emergency medicine, and obviously especially grateful for the leadership of Dr. Abbas Salam, who's on this call, who helped found that leadership summit, to Junaid Razak, and to many others who actually, to Farida, who is on this call as well. And I think we managed to bring all the people into one room who were the key stakeholders and drivers for wanting to help emergency medicine development. So I think we have some momentum to try and bring together those pieces. And the third point I would make is that, over the last few months, in combination with Junaid and others, just as you across the pond in the United States, although you've obviously been busy with trying to manage and understand some of the descriptions that your president is trying to understand what he's saying, that you've also been helping to focus us in collaborating. And so the third point is this virtual conference that we're running in January. We're going to hopefully have 7 tracks of speakers, and those speakers will be from 4 continents, from Australia, from Asia, from North America, and from Europe. And what we hope, especially with the enthusiasm of people like Junaid and Zafar, who I met yesterday, and of course all of the leaders in Pakistan, that we can actually continue to drive this forward. So I think the common aims of APPNA MERIT, as well as what we are trying to do in the UK, and what most importantly, what they're trying to do in Pakistan, is build the power of networks, ensure that we help lead systems in Pakistan, and have a structured approach. So those are the key thoughts that I leave you with. But thank you very much again for allowing me to contribute.
Thank you, Dr. Taj. It was very helpful, and thank you for your leadership and your service all throughout your life, and particularly, as you said, in the last decade. We are coming close to the end of this program, and wanted to go to Australia, who are already waiting for so long, and I apologize that they are early morning hours. But because Dr. Zafar Qasim has an emergency, he's on call, I'll just give him 1 minute and then I'll come to Australia. So Dr. Zafar Qasim, please brief with your comment.
Thank you so much to APPNA Committee and APPNA Merit, Dr. Shahid, and everybody on the leadership for the opportunity. Really exciting to be working with Dr. Junaid and Dr. Taj and colleagues across the world to provide some guidance to development of emergency medicine. Really key, I think, to have a forum like this to be able to discuss the ground realities and the ground needs, both in terms of grandfathering existing people working in clinics as well as emergency departments or casualty units in Pakistan, as well as the up and coming trainees as well. And so through our efforts with APPNA Merit, through our international collaborations, we hope to continue. We had some really good discussions yesterday on a case conference that we'll hope to continue on at least a monthly, if not bi-monthly forum. And we really need continued feedback on how to adapt our evolvement of emergency medicine, which really reflects the evolution of emergency medicine in the UK and the US to the Pakistani audience. So I'm really excited about the opportunity to be involved with this and look forward to collaborating with all my colleagues. And I'll leave my comments there. So just to help wrap up this forum, but again, I appreciate being part of this.
Thank you, Dr. Zafar Qasim. Thank you for your leadership, working with Dr. Junaid Razak to lead the American side of this collaboration and coalition. So last but not the least is our Australian counterpart contingent, and I will invite the president of the AAP, which is Australian Association of Pakistani Physicians, Dr. Majid Gondal, to then introduce Dr. Farida Khaja and tell us how the Australian group will collaborate with this broader coalition. Dr. Majid, go ahead.
Thank you very much, Dr. Shahid and Dr. Danish, for your wonderful efforts through APPNA Merit program. Now, Pakistani diaspora organizations have been working towards a better health system in Pakistan. And earlier this year, Australian Association of Pakistani Professionals signed a MOU with APPNA Merit and APPNA in order to work for the common cause. Now, I would like to mention our chair, Dr. Yusuf Harun Ahmed. Family medicine rotation program is part of our partnership, and he's been working very hard along with other Australian subspecialists and family medicine specialists, and they are actively taking part in these academic programs. Now, emergency medicine case discussion is another key education and training activity to learn from each other experience. And Dr. Shahid from Australia, Dr. Farida Khaja will be leading this initiative from up. Now, Dr. Farida Khaja, hailing from Sialkot, is a fellow of Australian College of Emergency Medicine. Now, currently, she is working as a full-time consultant at a beautiful hospital in Launceston, the state of Tasmania. She is a co-director of emergency medicine training, deputy censor for Tasmania, and co-country representative to Pakistan for emergency medicine. Now, she has been working day and night to work for Pakistan, and she has facilitated launching the emergency life support program, and she regularly coordinates courses in various locations. So now I would like to invite Dr. Farida Khaja to tell us how she will be leading from our side in this wonderful program. Dr. Farida Khaja.
Dr. Khaja, please. Yeah, go ahead.
Thank you. Unmuting myself. Assalamu alaikum, everyone.
Sure.
Lovely to see lots of familiar faces and also lots of new faces. Dr. Gondal, thank you for introduction. I will be brief. It is 1:30 in the morning here. The thing is that really I am joining in on the back end of a lot of absolutely amazing initiatives that have occurred in the country for over 10 years. It's really lovely to see how now there's this coordinated effort occurring internationally and locally to really prioritize. And it's going to be, I think, really important to listen to those leaders who are saying emergency care is one of the most important specialties, together with family practice. I agree. Those are the two main inroads that come through in the hospital. How do we strengthen those? Having a common vision. With that, making sure that we really speak as one voice, and you know, I, as somebody who's based outside, don't actually undermine those local priorities. And so the Pakistan Society of Emergency Medicine being supported to be strengthened and have that voice with the government. And that's what's been really lovely with the initial conference, and then the leadership summit next year, and I think the upcoming conference that has been mentioned by Taj, which he's leading together with Abdul Salam Khan, and it's an honor and privilege to be part of that. And I hope to be able to support in the various tracks that are happening as well. So we are gathering a database of all of the emergency physicians, Pakistani origin, in Australia, and then they will be supporting this effort as well. I just want to mention that the things that I'm concerned about are really about standards as well, because there's quite a lot of different initiatives occurring, and hopefully through this collaborative effort, we can ensure that standards are maintained because or kept up, because it's a fragile position to be in. All over the world, emergency medicine is relatively young specialty, and so struggles to be recognized. And if the standards are not maintained, we will struggle with that significantly in Pakistan. And to keep those standards, there's some very innovative projects happening, like what's been happening at Indus Hospital, where I have taught as a faculty member about a year and a half ago, the certificate program for emergency medicine. And that's a program where actually emergency physicians come and are based at the hospital for a month, and they are both part of the didactic training and hands-on training. Which has been adapted now with COVID. And what's wonderful is that you've got local leadership that actually ensures quality and applicability, because it's such a practical, hands-on specialty. And we have been doing actually online training during COVID, because a number of patients in the department who were ICU level patients had blown out of proportion, which has been a silver lining in the sense of acquiring lots of modern equipment, but then training and being able to use it effectively. So we've been actually conducting online courses already I've had physicians from Italy who had frontline experience talk and train the people at Indus Hospital, together with ICU physicians and emergency physicians in Australia as well. So that's been a real pleasure. So hopefully the learnings from this is something that can be exchanged with APPNA and APPNA's initiatives as well. And we can all work together. So this is really exciting, and I look forward to meeting more of you in person and on Zoom more frequently. So thank you very much.
Thank you, Dr. Farida, and thank you for staying up so late and being part of this collaboration. Last but not the least, our president-elect, who will be the president next year in 2021, Dr. Rizwan Khalid, is a very eminent cardiologist, having 3 subspecialties: electrophysiology, interventional, and ultrasound, and many others. Is a professor here in America, and at this point, actually, he's sitting in Lahore, and probably preparing for also his next year's agenda and work. And I'm sure that will be a great year for APPNA as well as for Merit. So tell us, Dr. Rizwan Khalid, about your vision for next year, as well as close and thank all the participants this webinar.
Yes, Assalamu alaikum, everybody, all the guests. Yes, I am in Lahore, Pakistan right now with my parents. It is indeed a great privilege to always, participate in APPNA Merit, one of the most active committees in APPNA, which is, such a great work that has been done both by Dr. Danish Bhatti and by Dr. Shahid Rafiq. So at this point in time, I would like to thank all the illustrious guests that have come from all over the world, including the US, Dr. Junaid Razak, my very good friend, from the UK, from the Association of Physicians of Pakistani descent of Northern England. I'm very glad to see the Australian participation as well, and it's late night there in Australia, and consistently participants from Australia have been participating in our meeting, in other APPNA Merit meetings as well, and we are very, very happy, and we owe you a debt of gratitude for coming at such an odd time. And obviously, APPNA Merit is for Pakistan and for transfer of technology and education in Pakistan. So I cannot thank our participants from Pakistan enough. Professor Khalid Masool Gondal, Professor Umar, Professor Abdul Salam, and so many other illustrious guests, chief executives, vice chancellors, head of departments, president of Pakistan ER Society. So I'm very glad to see you all, and in starting with us another chapter under the auspices of APPNA Merit to advance the field of emergency medicine in Pakistan. Certainly our support will be there with you during next year as well. Certainly, we only have a couple of weeks left. So this is something that is going to continue. Not only will it continue, I can promise that this will flourish further. And Dr. Junaid Razak is my good friend from Aga Khan as well. So we are discussing other things that we can do under the auspices of APPNA Merit. And I have listened to all the suggestions from our worthy guest, and many of these we will put into action. So with that, I would close my remarks. Thank everybody again for coming, taking time out of your Sunday and participating with us and helping APPNA and APPNA Merit. Hopefully we will be able to do better for our patients in Pakistan and for our homeland. Assalamu alaikum.
Thank you. So that will be all. I'm sorry, and I appreciate people staying in over the time. And so see you next time. Thank you. Assalamu alaikum.
Assalamu alaikum.